Hello. I want to thank Hannah for that introduction and just add a little bit that my husband and I are not big fans of the cold up here in the Des Moines area. Is much colder than it ever was in Kansas City, and the wind is fierce here. But we are so enjoying living in Iowa and being in the Des Moines community and in whole. We're excited to raise our kids here. Well, they're sort of almost raised. They're teenagers, but we still have a few more years of raising them. And so we're excited to do that in such a great community. And I personally am thrilled to have returned to my alma mater to come back and teach medical students in the same place that I learned to be a physician. Is it's an honor, it's a challenge, and it's a definite blessing. So before we get going, I also need to introduce just a couple of things. I am not a fan of recording lectures. I feel that when I'm live, I do so much better. I can engage the audience. I can ask questions and, call on you and you can shout things out. And this is just kind of, but it's where we are right now. And I just wanted to thank you for being here with me. Part of what I do that I've noticed when I watch my recordings is I say all the time. So I'm trying very hard to not you to death. But forgive me in advance if I do. Another thing that I hope you'll forgive me is that when I'm nervous, and I'm super nervous right now, I do feel like my mouth gets super dry. So I have a little bottle of water and I will occasionally need to take a sip of it. And again, I hope that you will forgive me of that. Okay, so financial disclosures. Des Moines University is the only organization who pays me anything, and they just pay me to do my job. And this is part of my job, and I'm excited that this is part of my job because I would like to possibly have one or two of you decide to try out the Des Moines University Family Medicine Clinic. I don't get any kickbacks from any vaccination companies or drug companies or any rewards or anything. So what I'm saying to you is based on my experience, my beliefs, and some stated truths that are in the medical literature. So nobody is paying me anything to talk to you about what I'm talking to you tonight. Okay, so when I was preparing for this lecture, I wanted to find a picture of a multicultural family or multiracial family, and I found one. And not only is this family have a variety of races reflected in it, as so many of our families do. My own daughter is adopted, and she's multiracial, and but I also love that these are a multi-generational family. I see some kids, I see some people maybe in their 20s, 30s, 40s, and then I see some seniors. And this really reflects the joy that family medicine providers have caring for people of every age group. We like to say that we can take care of people from the womb to the grave, and hopefully that those are spaced out by 90 to 100 years. But we very much enjoy taking care of people from every age group and every racial background, ethnicity background, and we work well with interpreters, things like that. So before we go on, I want to also share with you my, so basically I want you to, by the end of this presentation, say, hey, maybe I need to go get a wellness exam, or maybe my neighbor needs to go get a wellness exam, or my spouse needs to get a wellness exam, or my adult child needs to go get a wellness exam. And we don't necessarily want you to come to Des Moines University Family Medicine Clinic unless you don't have a provider, and then give us a try. But if you have somebody that you are hooked up with and that you follow with, I think that is just absolutely great. I don't want you to feel that you have to come to see us for your annual wellness exam. I just want you to get an annual wellness exam. So if you've got a provider that you're comfortable with, great. I want everybody to have a provider they're comfortable with. And see, here we go, water time. Okay, So, you probably thought when you signed up for mini medical school that you were going to learn something about being a physician. Well, you know what? I teach something similar to this to the medical students here at DMU, because we're going to be talking about the recommendations by the big health groups as to what needs to happen during a wellness exam in terms of screening for preventable diseases, as well as vaccinations and immunization updates. So I talk about this with the medical students, and please remember that all providers are also patients. So even though I'm a physician, I'm a family medicine physician, board certified, have, some fancy letters after my name that means I've impressed somebody, but I'm still a patient. And so I personally had to leave my primary care physician of 18 years when I moved up here, and now I found another primary care physician who's in the greater Des Moines area, and we're getting along famously. But I tell you what, leaving my doctor was a huge. It didn't feel good, because she knew me so well, and she knew when I was trying to pull a fast one on her and maybe not being as honest with her or myself as I should have been. So I will get there with my new primary care provider, but I just want you to know that physicians are patients, and physicians care for patients, and physicians assistants are patients, and physicians assistants care for patients. So all of this it's just one big continual loop. So, does everyone need an annual physical? Well, like any statement, there are pros and cons. There are people who say yes, and there are people who say no. So I found just a couple of quotes here. This was when I was preparing this lecture for the first time, providing it for a group of employees at the university that I worked at in Kansas City, and so that was in 2018. But it's still the truth that the CDC believes that this is a time that we can kind of identify health issues before they start, and if you do identify something bad, then it's going to be early when the chances for a complete cure are more probable. And then there's this article from Time where it said that maybe an annual health exam for many people would be just kind of a waste in time and money. But if you go on to read this quote, this is the same Time article, and they also said that closer physician-patient relationships may improve quality of care. And they went on to mention in this article that this gives the provider, and I use provider because I don't want to discount nurse practitioners or physician's assistants who are mid-levels that also provide family care. I am a physician, but that doesn't mean that I do anything differently than a nurse practitioner or a physician's assistant would do when providing an annual wellness exam. So basically the article went on to say that we would be able to know what a patient sounds like, what their heart sounds like, what their lungs sound like, what their abdomen feels like when we examine it when they're not having any pain, so that when they come in and they're having some sort of an issue, we recognize, oh, that's different than it was at their annual physical. So it also it makes the patients, if they come in and just sit down and get to know you a little bit and let you get to know them, it makes them feel a little bit better about calling you when maybe they're not sick, but they just have this question and they can't get rid of it, and they just kind of want to see you and talk it out. So that's why I feel like annual wellness visits are indicated. And then I'm going to talk a little bit about my own experience, that I take care of patients that have a variety of health conditions. So maybe somebody has hypothyroidism and type 2 diabetes and hyperlipidemia and high blood pressure and obesity. And by the time we see them to go over their regular medicines and things like this, there's not a lot of time in that encounter to review, oh, wait a minute, is it time for your colonoscopy, or have you had your female exam, or did you need to have a DEXA scan? So there's the wellness issues get kind of pushed to the end, and then we kind of run out of time. So during a wellness visit, I can learn what's new with my patient, learn what my patient's thinking about where they would like to see themselves from a health status 5 years down the road, so that we can then partner and I can help them make little mini goals and achieve their goals a little faster than maybe they could on their own. So it's not necessarily the exam, although the exam is a big part of it. But it's also just kind of the talking and the getting to know the patient on a different level that happens during a wellness exam that is beneficial both for the provider as well as for the patient, in my opinion. Okay, water break. So let's talk about what is water. And so what is wellness? Silly Sarah. Wellness is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is the definition by the World Health Organization. It's on their website. You can look it up yourself. I don't think, given this definition, that anybody on this planet is completely well, because you're always going to have some not well-being. Maybe your mental well-being is not as it was before the pandemic, when you have now been isolated and cut off from hugging your extended family members and doing Thanksgiving by Zoom. These types of things kind of affected all of our mental and social well-beings. And so I believe that that this is a great definition, and it's something to strive for. But and the most important thing is that wellness is not just not being sick. Wellness is a different thing than just not being sick or not having an illness. And so let's talk about some of the components of wellness. And the first thing we're going to talk about is the non-medical stuff. And I'll be honest with you, I'm sort of a frustrated social worker at heart. I love to hear people's stories. I love to hear why they chose the career that they chose, or I like to hear about upcoming vacations and funny things that the kids did at home last night. And so I like to have a relationship with my patients. But besides their relationship with me, I know that it's really important for them to have relationships with other people. Now, by relationships, I'm not talking about romantic relationships or sexual relationships. A relationship could be with somebody who has just been present for many, many years. Sometimes if I were to ask a group of 5 people, okay, I'm going to give you 3 minutes and then you're going to die. But in those 3 minutes, you get to spend time with one person. Who would it be? For many people, they would choose their spouse. For many people, they would choose one of their children or a sibling. But for many people, they would choose a very close friend. Not that they have ever dated this friend or been had a sexual or romantic relationship with this friend, but just that's my person. That's the person that I want to spend my last 3 minutes on this world with. So they did a study. They, and I've got the source down here if you want to look it up. But they did a study of over 300,000 people, and they found that a lack of strong relationships increased the risk of premature death from all causes by greater than 50%. So, and I apologize for the typo. Gosh darn it. But this is greater than obesity and physical inactivity. And we know that when somebody is stressed, they release hormones that do bad things to the body. But what we're recently finding out is that caring behavior, either somebody doing a caring behavior for you, or you doing a caring behavior for other people, releases a stress reducing hormone. So stress can clog heart arteries, affect gut function, insulin regulation. It can disturb your sleep. It can disturb your immunity. But if you care about somebody and you are the recipient of a caring behavior, then you may release a stress reducing hormone to counteract all of those bad things. So I think relationships are awesome. Again, frustrated social worker. Wish I could have been a social worker. Just no time. I had to choose something. I chose being a physician. But the great thing about physician is I get to ask these types of questions of people and satisfy that little social worker itch of mine. Okay, more water. Sorry. Let's talk about habits. I think if you look at me, you know that I'm overweight, and therefore I have a bad habit of eating too much of good, healthy foods. I do have a variety of foods, and I eat healthy foods, but I also eat way too much of the brownies and the things that are not necessarily so healthy, but gosh, they taste good. So that's a habit that I personally am working on. I've never smoked. I've never used drugs. I occasionally have an alcohol beverage if I'm, with a friend or something, but it's not a problem in my life. But for some people, food, alcohol, drugs, cigarettes are toxic habits, and they interfere with that person being the person that they want to be. By the same token, some people have habits that are good for them. For example, exercise. That's a great habit. Meditation, that's a great habit. It's stress reducing. Yoga, it's a great habit. It's stress reducing. So there are good habits and there are bad habits. Unfortunately, I've got the bad habit of liking to eat too much, and I don't have the good habit of balancing that with daily exercise. So that's why I'm overweight. So this is just a little self-disclosure of my habits. Other habits that we might talk to people about would be, what are your sleep habits? What are your caffeine habits? How much caffeine do you use? What are your habits for wearing your seatbelt? Because everybody should wear their seatbelt. So these are some habits that your primary care provider may discuss with you at your annual wellness exam, just to try to commend you for doing the things that you're doing that are good, and maybe slightly give you a little nudge to change the things that you're doing that aren't necessarily as healthy for you. So that's what we talk about. It's a non-medical thing, but I think it's an important thing, and that's part of what would be explored during an annual wellness encounter. Also explored are matters of spirituality, and not every primary care provider knows that they're doing this, but I think if they really look, they are, because we want to know what fills our patients' cups. And for some of you, that is belonging to a specific faith-based organization that worships a deity in a specific way. And for a lot of you, you don't particularly believe in a supreme being, and you would consider yourself an atheist, but you still are a spiritual human being, and maybe you get what's called like a runner's high when, and trust me, I know nothing about this from my own personal experience, but I've been told that people who run oftentimes will feel almost a time of complete peace or euphoria, and that's called the runner's high. And in a way, that's spirituality. That's something that makes them feel good. Other people practice meditation, and they get to a place where they don't think about anything, and that feels good. Some people are moved to tears by a beautiful piece of music, and that's a spiritual response. So I put a picture of a tree in there because other people are not necessarily religious, but they really enjoy nature, and they enjoy being out in the open air and hiking and looking at how the bugs interact with the plants and things like that. So these are all kind of related to spirituality, and there's been a lot of recent research about spirituality and how spirituality is very tied to whether a person has wellness or not. So this is something that your provider might just say, so what do you like to do? What fills your cup? What makes you happy? And for some of you, it would be spending time with your family. For some of you, it would be walking the dog. But this is the reason that your provider will ask you this, is because we want to make sure that everybody has something that makes them feel good or feel at peace. Okay, now we're going to move on to the medical stuff. Told you it was happening. So this slide, the picture here I took at the Des Moines University Family Medicine Clinic, and this is where when a patient is brought back from the waiting room, they would stop and have their vital signs assessed. So the reason we do this is the heart rate, the oxygen saturation, the blood pressure, the temperature, the height, and the weight, and changes among those types of measurements tell the provider a lot about health issues that might be going on. So I'm going to try to use my headset to mute so that I can cough. I apologize. I sure hope that worked and that you didn't hear me cough. But anywho, so after the vital signs are done, and you don't have to look at your weight. You don't have to, and you can just tell the MA, I don't really want to know what I weigh, and that is fine. Some people don't want to know. They have a history of eating disorders and they don't want to be triggered, or they're just embarrassed and they don't want to know, and that's fine. You don't have to know, but we do ask that you let us obtain your vital signs, because it means a lot to the provider and can help indicate health issues or health things that might need to be worked on. Okay, so now, I'm sorry, I'm still on this slide. I got all distracted with my cough. The provider, then you would go to a room, and when the provider comes in, you would kind of review your histories for updates. So have you had any surgeries since I saw you last? Everything going okay with your family? Have you started smoking? Have you stopped smoking? Kind of review your habits, review your social situation. Are you still living in the same place? Do you still have the same people in your home that were in your home last time? Maybe you've had a change in job. Maybe you have had a loss. Maybe you lost your mom or your brother or your child, and need to let your primary care provider know that, so that they know that that stressor is could be affecting your health. Then the provider would most likely do like a head-to-toe exam. It varies with recommendations and personal preference. And we'll get to this in the next slide. If the provider recommends a specific exam and you just really don't want it to be done, you can certainly decline it. Doing an exam without the patient's consent is basically assault, and we all know that that is not what we want to do. We don't want to assault our patients. We want to help them. So if you have a specific complaint, maybe, for example, you don't want somebody to evaluate the range of motion of your elbow for whatever reason, and so you can say, I just don't want you to do my elbow, and then the provider would probably ask you a couple of questions about that, but certainly would respect your wishes. Then after the exam, you would talk about your health issues, your own health goals, what you would like to achieve, and your plan. And then there would probably be discussion of recommended screenings and vaccinations, and we're going to get to that in just a little bit. Before we go to that part, though, I did want to talk about your a note about physical exams, and especially that you have a right to know who will provide your exam. A lot of people have students that are working with them, and usually, well, the student would, of course, introduce themselves. I've got a little picture of this girl playing with her doctor toys, and I just thought she was so cute. But I think you have a right to say, I don't want a student to do my exam. I prefer the provider. By the time students get to their clerkships, that means that they have done a lot of in-classroom practice of all of the examination tricks up their sleeve, and they've been checked off by faculty. So we feel that they're okay to do it, or we wouldn't ask them to do it for you. But again, you have the right to say whether or not you want to have anybody involved in your care. Also, if the patient, if your provider again wants to see how you can bend your elbows and that makes you uncomfortable, or anything else, you have the right to say, I don't want you to do that, and the provider would probably ask you why, and you can discuss that at that time. This happens a lot for private exams. A lot of times a provider will think that doing a pelvic exam on a woman, for example, is indicated, and the woman just really does not want to do that. So, of course, nobody's going to make you do any exam you don't want to do, but there will probably need to be a discussion about it, just so that it can be documented, and we can follow up on that later, see if maybe you've changed your mind next time. Also wanted to note that during the pandemic, some head and neck exams might be abbreviated or altered in some clinics. I personally am not doing this, but I have heard that some clinics are asking the patients to wear their mask during the entire visit, and therefore are not able to inspect the nose or the mouth. And so here's just a little article that kind of talks about the fact that that might be altered in a clinic that you go to. It doesn't mean the provider would use their own common sense as to whether or not it's okay to defer that exam based on your history and everything. But I just wanted you to know that that might be something that's going on at this time. Okay, water. So we talked about telling you what the recommendations are. So who makes these recommendations? Well, most insurance companies will go by what is recommended by the United States Preventive Services Task Force, USPSTF, and they make screenings for everything under the sun. And it's a panel put together that has people from every walk of life, and they look at evidence-based medicine, and they decide what is recommended based on what the literature suggests and what the data is. Insurance companies generally will go by those recommendations for payment. There are a few exceptions. For example, the USPSTF recommends Pap smears every 3 years for a certain population of women. But if the provider and the patient decide that they want to do a Pap smear every year, insurance companies are generally going to pay for that, even though it goes above and beyond the recommendations. And then for the vaccines, we look at the immunization tables that are published by the Centers for Disease Control, Dr. Fauci and his friends. And they do their immunization recs based on the National Center for Immunization and Respiratory Diseases. Again, these are experts in the field that look at numbers and make recommendations based on what is good for specific segments of the population. Okay, so but almost everybody gets some form of counseling, and that's because it's recommended by the USPSTF. And so I was doing some just searching for what do people have out there for what you can expect in your wellness exam, and the Cleveland Clinic has an actual brochure about what an adult can expect in their wellness exam. And this is counseling that they say is for all adults. So smoking cessation, alcohol and drug abuse prevention, seatbelt safety, safe sex practices, nutrition and exercise, and firearm safety. So if you have a gun, then your provider may ask about how do you make sure that it stays safe? Do you keep it locked? That type of thing. And then for some people, might discuss, based on their age, their gender, and their health history, hormone replacement or osteoporosis prevention. Then that's for all adults. Now we get into screening that is based on age and gender. So interestingly enough, both men and women should be screened for breast cancer. Breast cancer hits men not as frequently as women, but it is known, and therefore discussion of breast health and breast awareness is indicated at a wellness exam, so that if a man has an issue, 3 months later after the wellness exam, he's at least been told, if you have this symptom, that would be a reason to come back and see me. Cervical cancer screening, of course, just for women. Prostate cancer screening, of course, just for men. Then cholesterol screening, colorectal cancer screening, diabetes screening, hypertension screening. Hypertension is a fancy word for high blood pressure. Osteoporosis screening, and sexually transmitted infection screening would be recommended for age, specific age groups, specific gender groups, and specific habits and histories that are obtained in the interview. So here is a list of the recommended immunizations and vaccines. As parents among you know, the childhood immunization, it's so detailed. So there is no way to really put that on one slide. So I just kind of put the names of the specific shots that are recommended for babies, kids, and teens. And then on the adult, the hepatitis A and B and the meningococcal are only recommended for people who meet certain criteria for histories, meaning places that they've worked or traveled or things like that. I put the COVID-19 vaccine here because it's out, and I've had one dose. I believe by the time this airs, I will have had my second dose. We do not have it at our clinic yet for patients, but we are on the list, and we're going by what every week on Friday, Polk County decides who gets the vaccine the next week, and we are on the list, and they know we're on the list, and we've signed all of our papers and have been inspected, and we're good to go. So as soon as we have the COVID-19 vaccine, we will certainly let our patients know that they can come get it. But these are some immunizations that adults may qualify for. And I wanted to talk about a couple that are that people really don't think about, and that is the varicella zoster. This is a vaccine to prevent shingles. And those of you who know people who've had shingles, it's a horrible disease, but we're not as worried about the shingles as we are the problem that can come after it, which is post-herpetic neuropathy. And people who have that can have just a lifetime of pain. So we want to prevent the shingles because the shingles hurt, but mostly we want to prevent the lifetime of pain. This is indicated for anybody 50 years or older. And if you had the old Zostavax, then you need to come in and get the newer vaccine, which is a 2-shot vaccine protocol, because it will protect you better. Another thing that I wanted to point out is besides having your annual flu shot, we all know that people who are pneumococcal is sometimes called the pneumonia shot. And we know that people age 65 and older qualify for a pneumonia shot. But what you may not know is that younger people who have a health condition such as diabetes or asthma also qualify for a pneumonia shot, as well as anyone 21 years or older who is a smoker should be having a pneumonia shot to prevent pneumonia. And insurance will pay for that. So this is something that a lot of people don't know about, and so they don't necessarily see their physician to get that. Okay. So what happens after a wellness exam? Well, maybe we're going to have the nurse bring in some vaccinations if you've agreed to that. Maybe we'll go ahead and do a blood draw and run some labs. Maybe we'll do a special test like an EKG right there in the clinic. This is an EKG machine. Maybe we'll refer you to another provider. Maybe we need you to see a specialist because your rheumatoid arthritis is not as well controlled as it has been for the past 3 or 4 years, and so we need a specialist to give us some advice on what to do next. Or maybe you need to see any other, I mean, there's so many specialists. I mean, you just pick a disease and there's somebody who specializes in that. So if we feel that we cannot take care of you, or if a specialist would add something to your care, certainly we're going to refer you. And sometimes patients just want to see a specialist, even though they have trust in us as family medicine providers that we know what we're doing. They just really want to see, a specialist for whatever reason, and that's absolutely fine with us. So, okay, so that might happen. So now I want to talk about our clinic, and our clinic is at 3200 Des Moines Avenue. That is the east side of our campus, which stretches out, I think there are like 3 city blocks on Grand Avenue, but this is at the very east side. This is the entryway here on the right, and you've probably seen this on your travels along Grand Avenue and just been like, what's that? Now you know. So, and there are some patient-friendly reasons that I think you should come see our clinic. First of all, these are 2 of our receptionists. They are in a little room that has been plexiglassed away from the waiting room. These were some measures that were taken at the beginning of the pandemic to keep our staff as well as patients safe. Everybody in our clinic will wear a glove, will wear a mask. Sometimes they'll wear face shields as well. But the things that are good for patients that I wanted to point out is that, if you're sick, sometimes you want to be seen right then, and we do have same-day appointments available almost every day. We also, for our established patients that we've seen before, we have drive-through screening. If you feel like, I've got some cough and sore throat, and I'm not sure if it's COVID or strep throat or flu, we can actually have you drive up to one of our drive-up clinics and send a provider out to your car. They can do kind of a mini exam with you in your car and then go ahead and test you. COVID tests, of course, have to be sent out, but we have rapid tests for strep and for flu that we can get those results back to you within 3 to 5 minutes. We do have covered parking, which are just steps away from our clinic. You don't have to go outside. You just go straight from the covered parking right into the building. We have on-site radiology and blood draw services. Sometimes we can draw your lab and give the result right then. For example, if diabetics oftentimes need to have we call it hemoglobin A1C, and it's like a check of what the average blood sugar was for the past 3 months. Well, we can just do that right there. We don't need to send that off. We can just do that. We can also look at your blood count and some chemistries, see what your body salts are, things like that. We have other clinics in the same building that we're on the 5th floor, but we have other clinics in our building. We have physical therapy, podiatry, and osteopathic manipulation. So if we need to refer people to them, it's easy peasy. We share the same computer tool, and it's just it's easy for us to get you in, and it's easy for us to see what they did. And soon we're going to have behavioral medicine coming into our Tower Clinic as well. And that will mean that we could refer you to psychiatry or for counseling right there in our own building. So these are all patient-friendly features that I wanted to point out. If you would like to see any of these people, these are our providers, Dr. Akins, Dr. Crosby, Rachel Doggett, Sheila Garner, Jolene Gavant, and April Vargas are all physician's assistants with just years of experience, and they are fabulous. Dr. Harder, yours truly, and Dr. Volker. I would trust any of these people to care for me or my family, and they are very, very good. You could call 515-271-1700 for an appointment. If you're not sure whether or not our clinic would be right for you and you want to discuss specific questions, you could certainly email me. Here's my email. It's Sarah Parrott, H on the end of Sarah, 2 R's, 2 T's on Parrott, at dmu.edu. Or our practice manager, Megan Johnson, who is a nurse with years of experience both in primary care, and she also did a lot of work in cancer units before. But she can be reached at megan.johnson@dmu.edu, or her number is 515-271-1493. Again, if you're not sure whether or not the clinic would be right for you and you just have a couple of questions, or maybe you want some help in choosing a provider that meets what you want your provider to be, we could certainly talk you through those types of decisions. And finally, if you have any questions about this presentation, please send them to Hannah. She's going to collect them all and get them to all of the speakers, and hopefully we'll get back to you in a fast manner to answer any questions that you have about annual wellness exam or anything that is mentioned in any of the mini medical school lectures. Again, it has been a pleasure to speak with you. I was supposed to keep this at 30 minutes, and I apologize, I went 41 minutes. But it was a pleasure to speak with you, and I hope to meet some of you face to face one day. Stay safe. Thank you.